My name is Yadira Viteri, neoneuron lupus complication. Definition is an usual passive autoimmune disease that affects the fetus and the newborn, passing maternal antibodies through the placenta. Characteristic of the disease being the anti-Rho anti-La.
Lupus affects over 5 million people worldwide. You may have heard of it. You may know someone with lupus. But what is lupus? Let's take a look. This person is healthy. Hello. Everybody has white blood cells. They protect people from infections. This is what stops you from getting ill. In people with lupus, however, the white blood cells aren't so helpful. The white blood cells are out of control. They won't just attack infections, they'll attack anything. This is what causes all their symptoms. Symptoms of lupus can include extreme fatigue, joint pain, muscle weakness, rashes, hair loss, and it can also damage organs such as the kidneys, heart, or brain. There are a few things that can trigger symptoms in lupus patients. One of them is the sunshine. About 60% of lupus patients are sun sensitive. Another trigger is stress. It is very important that lupus patients take good care of themselves physically and emotionally. At present, there is no cure for lupus, though it can often be managed through treatment. A big problem is that it takes an average of 7 years for somebody with lupus to get a diagnosis and receive this treatment. You can help to reduce this time by sharing this video and raising awareness of this condition. Lupus mainly affects women, but it can affect anybody. To learn more, visit us at www.lupusuk.org.uk.
Application in medicine. Maternal autoantibodies and the Rolla family are present in virtually every case. Also, only approximately 1% of women who have these autoantibodies will have a baby with neutral lupus.
Hey guys, so today I just have a very quick video. I want to talk about a few things before I have class very soon, but basically, if you guys haven't heard, which I'm sure you have, Kevin McHale's daughter, her name is Sasha McHale, passed away from complications of lupus. And Kevin McHale is basically an NBA Hall of Famer, and he's also a basketball coach for the NBA now. And it hit really hard because her daughter was 22 or 23, I'm not exactly sure. But for me, it was like, it made me think, because it could happen to me, you know, and not even that. I know I'm doing really well, but that's the thing about lupus, is you never know. You can be doing amazing, and then the next day you're going into kidney failure. And I had a really emotional night last night because I was thinking about this, and I also was watching this video, which I will link below because it's a beautiful video, and I've probably watched it about 15 times now. And if you don't have lupus, please watch this. It just shows so much of what we go through, and I can only dream of making a video as beautiful as this one. And one day I hope I can make a video like that, because it's so beautiful, and it just has so much meaning to it. And I'm just very emotional. A lot a lot from this girl passing at a very young age with lupus, which happens all the time. Usually I do hear about every month at least someone passing away with lupus from one of the groups I'm on Facebook, or just from friends who on Facebook who have lupus, who know people, and it's a great video. Check out the video. And I wrote down a quote that she said in the video, and I love it because it's what I try to tell you guys all the time and talk to you about. She said, "I realized then and there that you're the only thing standing between your quality of life." And it's true, because, and she talks about all this in the video and how we don't get to choose if we want lupus or not. We don't get that choice. And she talks about acceptance, and she talks about the hard and the issues about it, and how it's almost cynical, and just so many things. And it's so relatable, and I know you all can relate to it who have lupus. And a couple of my friends that I've met who have lupus, I thought of right away when I was watching this video, because I knew they would definitely relate, because they've been going through tough times right now. And that's all I wanted to say for this video. I want you guys to check that video out. Let me know what you think, and just I hope you guys, everyone, just stay healthy. All right. Take care of yourself. And I want to make a video about that, and just people not taking care of themselves. I had a friend in town this weekend, and I wasn't able to hang out with her. I wasn't feeling very good this weekend.
The lane effect one in 20,000 newborn, the clinical manifestation in this disease disappear in 3 to 6 months without leaving on damage. Cons. It's a chronic disease which affects one or many tissues of the body, skin, brain, muscle, blood vessel, blood cell, brain, or nerve.
Hi, I'm Laura. I'm 28 and I've been living with lupus for about 10 years. Lupus can cause lots of different symptoms. I mostly have difficulty with extreme fatigue, pain and weakness in my muscles, mouth ulcers and kidney problems. Lupus can also cause hair loss, skin rashes, seizures, blood disorders, and can attack other organs. Like many people with lupus, a lot of the time I have no visible symptoms, so I don't look unwell. In fact, I often look really healthy, despite feeling awful. This generally makes it a lot more difficult for other people to understand my illness. When people ask me how I am, and I tell them that I'm really fatigued or in pain because of my lupus, I will often receive comments like, "You look okay to me," or "Maybe if you had a more positive attitude, you'd feel better." These types of comments are not very helpful and make me feel much less able to ask for help if I need it. I find that the fatigue is probably the most difficult symptom I deal with from day to day. Lupus fatigue isn't just like normal tiredness. It makes me feel completely drained, and sleep doesn't make me less tired. I have to be very careful to pace myself. It's important that I plan how I use my energy. If I'm going out for the night with my friends, then I generally rest a day before and a couple of days after. Even then I struggle to keep up. When I have to leave early because of my tiredness, I worry that I'm letting my friends down and upsetting them. Like most people with lupus, I am light sensitive. If I spend even a short amount of time out in the sun, then it makes me feel really unwell. Being light sensitive means that I often find myself trapped indoors. If I do go out in the sun, I have to make sure I regularly apply factor 50+ sun cream, cover myself with clothing as much as possible, stick to the shade, and avoid the hottest parts of the day. Having to cover up like this makes me worry that I stand out. There are some things that you can do to help make things easier for people with lupus. First of all, it helps a lot when you know about lupus and its symptoms. You can learn more about lupus by going to the Lupus UK website, www.lupusuk.org.uk. You can also keep up to date on the latest news and helpful tips by following Lupus UK on Facebook and Twitter. Another way you can make things easier is to offer to help at home or in the workplace. Helping to lift and carry things can help reduce joint pain and fatigue. Giving a helping hand with the cooking and cleaning allows people with lupus to get more rest and manage their fatigue better. It's often not possible to tell how well I feel just by looking. I often look fine when in fact I'm really struggling. By asking me how I am and by asking if there's anything you can do to help, you could make my day. Lupus is a chronic illness with no cure at present. For many people, it is a condition that has peaks and troughs, so they may have periods where they're relatively well and others where their symptoms are worse. Lupus is neither infectious nor contagious. Thank you for watching this video. Please help care for people with lupus by supporting Lupus UK.
Uses applied in Ecuador. Tutor of patients with skin finding have seen appear to children with cutaneous lesions should be evaluated for hematologic, hepatic, and cardiac involvement. Conclusion. Neonatal lupus is an autoimmune disease in which passive strength or autoantibodies for the mother on the fetus result in fetal and neonatal death. The major manifestations are cardiac and cutaneous findings. The most serious complication is complex